Hello, I'm Dr. Praveen Ravishankaran, a robotic cancer surgeon with a special interest in advanced minimal invasive cancer care. Over the years, I've had the privilege of treating patients across a wide spectrum of cancers using cutting edge technologies like laparoscopy and robotic surgery. My work is focused not just on removing cancers, but on doing it with precision, minimal pain, faster recovery, and a better quality of life for my patients. Every surgery I perform is a balance between science, technology, and compassion because behind every diagnosis is a person, a family, and a story. Through this platform, my goal is to simplify complex cancer care and bring clarity, awareness, and confidence to the people who need it the most. Today, let's talk about something that is often silent and often misunderstood, but very treatable when caught early: thyroid cancer. But before we get into it, let me show you a simple experiment. Here, we place an egg in plain water. It sinks to the bottom. If you take a glass of water filled with salt and put the egg inside, watch what happens. The egg slowly begins to rise and eventually it floats. A simple school experiment, but a powerful principle. Hold on to that thought. Now, many of you might have seen this moment from the movie The Wolverine. A Wolverine protects a Japanese soldier from a nuclear explosion. That scene is dramatic, emotional, and powerful. But it also highlights something very real: radiation. Radiation in controlled doses is used in medicine to treat cancer. But uncontrolled exposure, especially at high levels, can damage DNA and increase the risk of cancers, including thyroid cancer. Now, coming to thyroid cancer. The thyroid is a small gland in front of your neck, but plays a big role in regulating metabolism and overall body function. When cancer develops here, it is broadly classified into 4 types. The most common is papillary thyroid cancer, which is slowly growing and highly curable. Then comes follicular thyroid cancer, which is slightly more aggressive but still has excellent outcomes. Medullary thyroid cancer is different as it arises from C cells, which are small cells within the thyroid gland and can sometimes run in families. And finally, anaplastic thyroid carcinoma, which is a rare but very aggressive and challenging to treat. In many patients, we don't find a single direct cause, but certain risk factors are well known. Prior radiation exposure, especially during childhood, family history, genetic mutations, iodine imbalance, and a higher prevalence in women. The challenge with thyroid cancer is that it often does not cause any symptoms early. Patients may notice a small swelling in front of the neck, sometimes a slight change in voice or difficulty in swallowing at a later stage. And that is why awareness becomes critical. When we suspect thyroid cancer, the first step is usually an ultrasound of the neck. This helps us understand the nature of the thyroid gland. The next step is an FNAC, which is fine needle aspiration cytology, which is a simple needle test that gives us the study of cells and helps us to understand the diagnosis. In selected cases, we use a CT scan or MRI for further evaluation and specific blood markers like calcitonin when we suspect medullary cancer. Once diagnosed, the treatment depends on the type and stage. For most papillary and follicular thyroid carcinomas, surgery is the mainstay, either removing part of the thyroid gland or the entire gland. In certain patients, we follow this with radioactive iodine therapy to eliminate any remaining microscopic disease. Medullary thyroid carcinoma requires complete surgical removal along with the lymph nodes, and radioactive iodine is not very effective here. Anaplastic cancer, being very aggressive, often requires a combination of surgery, radiation, chemotherapy, and newer targeted therapies, though the outcome is poor. Now let me talk about something that has significantly changed the way in which we approach thyroid surgery, that is robotic surgery. Traditionally, thyroid surgery used to leave a visible scar on the neck, which can be of concern for many patients, especially younger individuals. With robotic techniques, we can access the thyroid glands to hidden areas like the armpit, completely avoiding a neck scar. Robotic system gives us a magnified 3D vision, exceptional precision, better control, allowing us to preserve critical structures like the recurrent laryngeal nerve, which is important for voice, and parathyroid glands, which is important for calcium metabolism. The result is less pain, faster recovery, superior cosmesis, and effective cancer clearance. For me, this is not just technological advancement, It is about treating cancer while preserving dignity and confidence of the patient. Now, coming back to our experiment, why did the egg float? As we added salt, the density of water increased. When the density of the surrounding fluid becomes greater than the density of egg, it generates an upward buoyant force, allowing the egg to rise and float. In a similar manner, when we increase awareness, early diagnosis, and access to advanced treatment, we change the environment around the disease. We create conditions where the patients are no longer overwhelmed by the disease, but supported, elevated, and given a real chance to overcome cancer. And that brings me to the most important part. Thyroid cancer is one of the most treatable cancers there is, but only if we detect it at the right time. A small swelling in front of the neck may seem insignificant. A mild change in voice may be ignored, but these small signs can be the body's early warning systems. Listening to them can make all the difference. We're living in an era where cancer treatment is no longer limited to just survival. It is about precision, personalization, and quality of life. With advancements like robotic surgery, targeted therapy, and better diagnostics, outcomes are better than ever before. But none of this matters without awareness or timely action. So I urge you to be aware, to be proactive, and never ignore what your body is trying to tell you. If this video has helped you understand thyroid cancer better, do share it with someone who might benefit from it. Subscribe to the Wellness Oracle for more clear, practical, and evidence-based insights into cancer care. Stay informed, stay strong, and I'll see you in the next video where we continue this journey of understanding and fighting cancer together. Thank you and have a nice day.